Dorcas Baker has been a registered nurse for 37 years, a graduate of the former Church Home and Hospital School of Nursing and Johns Hopkins University School of Nursing. She is currently employed by the Johns Hopkins University Local Performance Site as the site director for the Pennsylvania Mid-Atlantic AIDS Foundation and Training. Dorcas' past experience as a research nurse for 14 years in AIDS clinical trial has also contributed to her vast knowledge and expertise in the field. She has given numerous presentations, workshops, and seminars on HIV/AIDS in older adults in various healthcare and community settings. She was an invited panelist for the White House meeting on HIV and aging, sponsored by the Office of National AIDS Policy in October 2010. Dorcas coordinated the first HIV over 50 conference held at Johns Hopkins University in 2002, as well as the production of Johns Hopkins University's newly released HIV and Older Adults DVD. Dorcas also coordinates the annual AETC-sponsored Graying of HIV conference. She holds professional membership with the Association of Nursing and AIDS Care, of which she is the Chesapeake chapter's past president. She has served as a member of the Greater Baltimore HIV Planning Council and the former founder of the Older Women Embracing Life support group for women over the age of 50, living with and affected by HIV/AIDS. Welcome, Dorcas.
Thank you so much.
Welcome, Dorcas.
We also have Anna E. Fowlkes. Anna E. Fowlkes is an HIV/AIDS prevention advocate, activist, and spokesperson promoting HIV/AIDS education, awareness, testing, safer sex practices for all sexually active persons regardless of age. At age 59, Ms. Fowlkes was diagnosed HIV positive. She has exhibited and presented at various conferences, summits, community organizations, and faith-based groups throughout the Mid-Atlantic area. Ms. Fowlkes completed an HIV and older adults training conducted by ACRIA, HIV Health Literacy Program, and the Center on HIV and Aging. She also completed the Taylor Wicks Group Leadership, Empowerment, Advocacy, and Participation Training, where she received the CLEO Award, the program's highest honor. Ms. Fowlkes has creatively reached out to educate and promote HIV testing and safer sex practices, as well as safe and healthy living. She wrote and performed in 2 videos, Senior Dating, Older, Wiser, Safer, which deals with negotiating HIV testing and safer sex, and Love Ain't Supposed to Hurt, which deals with physical abuse and HIV infection. She has published several Examiner.com articles as a Baltimore HIV and AIDS examiner, reporting on local HIV/AIDS events happening in and around Baltimore, Maryland. Welcome, Anna.
Welcome, Anna.
Good morning.
Whoa!
We are so happy you guys are here today.
Oh
Glad
my
to be
goodness.
We really are.
Yes, we've been talking to everybody that we come in contact.
Mm-hmm.
We really appreciate what you are doing, Anna, putting yourself out there, putting a face to the disease in terms of in the senior community. We admire you so much for what you do.
Thank you. Thank you.
Okay, I'm going to start off with the basics. What is HIV/AIDS and how did it originate?
Well, HIV stands for Human Immunodeficiency Virus, and HIV has been around for a very long time. Here in the United States, the first case was diagnosed here in Maryland, as a matter of fact, in 1981. But HIV has been around before then. But it's a virus that attacks the immune system, and is attacked using such modes as unprotected sex. So it is a sexually transmitted infection.
Mm-hmm.
It's one of the STIs. And it's a blood-to-blood or body-fluid to body fluid, using blood as a mode, because HIV survives in the blood. Over time, if HIV is left on its own, it can lead to AIDS, which is a weakening of the immune system.
Mm-hmm. So how did it originate?
Well, when we talk about origination, that goes way back, even back into the 1950s. There's documentation that over in Africa, there were chimpanzee monkeys, a certain brand of monkeys that were used when they did religious rituals, such as blood to blood. It could have gone back as far as then. And we don't know were individuals infected because of that and then having sex over time. So there's a lot of history about that, and we're not sure we can trace it all the way, but there are theories, but that is one that is substantial. And if someone went to one of our websites, they can get more information on that.
Okay, and can you give us websites, please?
One of the websites that they could probably go to is AIDS.org, and they can also do a search of HIV origination.
Okay, thank you so much. We have Miss B. Miss B?
Good morning.
Good morning.
Good morning, Miss
Good
B.
morning. Welcome. Yeah, because you're actually live on the air with Cassandra, Kevin, Dorcas, and Anna.
Yes, thank you all for participating today.
Yes.
Something that's really needed to be talked about. And Anna, you're courageous. I mean, that
Yes, she is.
we can consider.
No.
So we applaud you.
Thank you.
Okay, what are the symptoms?
Well, HIV can go without symptoms. That's the thing that people don't realize. You do not have to have symptoms right away. But when we're dealing with the older population, we need to think of things, and sometimes aging can bring some of the same symptoms that HIV/AIDS can bring. But general flu-like symptoms can be for anyone, maybe a month or so when they first contact HIV for anyone. You may have flu-like symptoms, but sometimes you dismiss that because I have the flu. I had a cold, I have nausea, I had a little headache, achy feeling, general malaise, but that goes away and there are no more symptoms.
Right.
So you can walk around carrying the HIV virus, not even knowing that you've been exposed. But it can take the test that we do now can take up to 12 weeks to determine whether or not you have been exposed, because you're going symptom-free now. You're not even paying much attention, I had a flu. But sometimes it's very difficult for people to trace back when they were exposed to HIV. So there's a 3-month window that we usually use. When you're getting tested for HIV, it's just showing 3 months prior behavior. And remember, this is about behavior.
So what are the tests? Because I heard something about the swabbing of the
Yes,
mouth.
there's oral tests that we can do, the rapid test, and you can get results within 20 minutes.
20 minutes.
Within 20 minutes, it doesn't take that long, where you can have your mouth swabbed, and within 20 minutes you can get a test. And one thing that we're doing you can get a result. In Maryland, we do not have to have consent forms, which used to be a big issue. If you're in a medical institution or a place where there's a medical record,
Right.
you can also just not even sign a separate consent. Signing the general consent, I'm consenting to medical attention today, will cover getting tested for HIV. But if you're in the community, outside of a medical institution, there is a consent form that will be used, like a health fair or something like that. But the oral test is very quick, 20 minutes, you can know. If it's a blood test, it will take about 10 days.
You know, I was wondering, are the, I guess, government officials or government agencies, are they notified if there is a HIV positive?
The health department has to know, yes.
Okay. Is it transmitted through casual contact?
No.
Okay.
Anna, you can chime in.
Yeah,
No.
definitely not. You know, you can't get it from shaking hands, hugging someone, sharing food. You know, it has to be an intimate contact. Most people are infected through sexual contact. IV drug use is another means of infection, but what a lot of seniors don't realize is that they share needles that contain blood. If they share insulin, if they have diabetes and they stick their finger with a lancet, but if they only have one lancet and 2 or 3 people in the house have diabetic and they share it and they don't clean it, they can pass the infection. If they use a needle to inject insulin and they share it, they can pass the infection. Getting your ears pierced or getting tattoos is another risk of blood transfer, getting infected. But the majority of people that are infected got infected today through having sex.
Oh my gosh.
How about with oral contact?
That's the least mode of infection. You can get infected, but that's the lowest one. Generally, intercourse or anal sex are the primary means of infected, unprotected sex.
Okay. How about an incubation period? Let's say somebody get tested today, and they're they test negative and everything, and don't have sex for like another year. Is there an incubation period?
Well, like I said a few minutes ago, we have to remember there's a 3-month window that we have to consider. So if you tested today, that's showing what happened 3 months up until today.
Okay.
However, if there's any reason to believe that you may have been exposed or it's a good thing to do that you're still at risk, you get tested another 3 months. Okay? And even another 3 months, at least 2 consecutive negative tests. But the thing is, you have to remember it's an issue of behavior and knowing that you're putting yourself at risk. But get tested, know your status is the most important piece. 1 out of 5 people do not even know their status. So we're advocates of get tested, know where you
Definitely.
One
Get
out of
tested,
five.
get tested, get tested.
And let me ask you this: have we come to the point where a single person that's looking to date need to, I guess, have an application or something for the person that they want to date to make sure that they are negative?
And no, but they need to have a conversation. They
Okay.
need to be able to
Absolutely.
discuss with the person they're dating. If they're planning on being intimate, then they need to be able to discuss, have you been tested? If not, are you willing to get tested? And to practice safer sex, to insist upon practicing safer sex.
Okay.
Ladies can protect themselves with female condoms. They don't have to depend on a man to protect them. But they need to find out, as one person says, no glove, no love. And if a person is not willing to practice safer sex, maybe that's not the person for you.
I'd like
The
to comment.
the female condom, where can that be purchased? Can it be purchased at a local drugstore?
That's a big problem. You can get it in most health clinics, and they're free in the health clinics. I go in drugstores, literally CVS, Rite Aid, any of them, and ask for female condoms. I do it loudly at the
Right.
pharmacy because they have a million kinds of male condoms and no female
Yes.
condoms. And I suggest all women ask for them. If you have a lot of people asking, then the store will carry them.
With Cialis and Viagra and all of these other male enhancement drugs, do you see a rise in seniors with HIV?
And that's part of the reason, one of the things that we have to let seniors know, and we're using the term seniors, but we could be
Right.
talking about older adults, anybody over 50, seniors 65 and older, any age, anybody over 50, you need to think about this. Because with older men, not being able to have a sexual relationship the way that they want to and what they need to have happen physically will require the assistance of erectile dysfunction drugs. So one of our nationally known speakers and advocate, Jane Fowler, says if you can get it up, cover it up.
Yeah.
And also we need to be aware that in this day and time where older folks are dating again,
Yes.
they may have lost a spouse or relationship has changed, but they've been with one person maybe for many, many years and out in the dating scene again and know nothing about HIV. And that's another reason why we see an increase too, because seniors are left out of the conversation or older adults don't realize how things have changed. It's not like it was back in the 50s and 60s. You're dating again and maybe dating somebody younger.
Right.
Doesn't matter. Dating someone your age. Do you know their sexual history? Do you know their HIV status?
I just want to add too, in Baltimore and in a lot of big cities, we have a lot of high-rise senior
I was
buildings.
going to ask about that.
And consequently, everybody in the building gets a check around the same time of the month.
Yes.
And if you drive by any of these buildings, you will see a lot of younger people. I call them predators, but we know what they are.
Yes.
Young men and women. And the men flirt with the older women who may be lonely, you know, they've not had anybody tell them they look good for a while, so they're very receptive. And they get inside their apartment and they have unprotected sex with them. The young girls flirt with the older men, and they do the same thing. They may give that older man Viagra, but what happens by the middle of the month, the older people's money is diminished.
Right.
The young people are gone. And so that older man still has Viagra, and that older lady is still feeling a little frisky. And he may knock on her door. In most buildings, there are about 7 women for every man.
Yes, that's absolutely right.
So he may have a different lady every night of the week, and the virus is spread.
So Anna, can you tell us your story?
Well, I got infected the old-fashioned way. I had unprotected sex. But the person that I had unprotected sex with, I had known for 40 years. We grew up together on the same block. We went to high school together. And when we ran into each other, we were both in our 50s. He was separated from his wife, and I was widowed. And so our first date, we went to church together. We joined the church together, and we were just good friends. You know, I could cry on his shoulder and reminiscing and grieving over my husband, and he was receptive. We didn't plan on having sex. It just happened one night. And he didn't know how to tell me. He had a secret. His wife had left him. She was infected. and he just was afraid, I guess, of not having a friend. And so he didn't share it with me. A couple of years later, he got sick with pneumonia. And then I thought to ask the question. And he was honest and said he was infected. And of course, at age 55, to me, I had just finished menopause. Pregnant would have been worse than AIDS. You know, no lady wants to have a child in her 50s and know when she'll be in her 70s before the kid gets out of high school. So I wasn't angry or anything. When I was 57, he died. And I felt fine. And so I didn't complain, you know, and another 2 years went by, and then I began to exhibit the only symptom I've ever had, which is chronic fatigue, which is, you know, just too tired to get up and answer the door or think twice about going to the bathroom. And so I got tested, and I suspected that was what was wrong. And so when I was told I was positive, I wasn't really upset or bent out of shape because I knew there was treatment available, and I knew I could live. It was not a death sentence. So I knew I could live a good, healthy life.
So older men pretty much have to be, I guess, sort of retrained a little bit because if they're seniors, I'm pretty sure they went through a life period where they wasn't, wasn't using safe sex and protected. And now that they're older, and you know, you had the girls that had their little sugar daddy, they didn't have to worry about the sugar daddy too much about, you know, getting involved like that. But now, like you said, cuz, so you got Cialis and the whole kind of medicine they can take where they can put in some work now. They have to sort of like retrain themselves to be able to protect themselves.
Exactly. It's
Yeah.
a lot of need to educate all, male and female.
Okay.
Exactly.
We have Derek on the line. Derek, I'm sorry, we just have a few seconds. What's your comment? Hello?
Hello, Derek, you there? We have to,
Okay.
Go to
we
another
have keep
caller.
moving. Charles, you're on the air.
Yes, I wanted to know,
3 months is the indicator. That's the 3-month window. It wasn't effective. 3 months. We need to know. It's easier to find people earlier, to get tested, know where you are right now, know what your behavior has brought to your table or not brought to your table within the 3 months of being tested. 12 weeks. Sooner is better than later.
But I will say, if you, yes,
Yes.
but I want to say, if you've had
Thank you,
unprotected
Charles.
sex for over 5 years, then you really need to get tested.
Exactly.
Okay, a lot of people go for 5 or 10 years and not get tested, and it's important to immediately get tested.
Exactly.
Are there any other sexually transmitted diseases that you see prevalent in the senior citizen community?
Well, seniors are susceptible to sexually transmitted infections just like anyone else. And so still being on the lookout for syphilis, chlamydia, trichomonas, the others as well, is still just as important.
Okay. I have a scenario. Let's say you have two people that have been married before, and then they're both divorced, and now they're dating each other, and they've been dating for a couple years. Been having protected sex and unprotected sex, sex at the same time. And then maybe the man's ex-wife calls, and she's jealous because he's got a new woman now, and it just springs it on him. You need to get checked because I know I done passed something to you. So now he gets tested and he finds out that he is positive, and then his girlfriend gets tested and finds out that she is negative. Do you have any advice to, as far as their relationship, to keep it like that?
Well, yeah, they need to immediately practice safer sex. She needs to get tested twice, again, the second time. A lot of people, I suggest that most couples get tested together. That way they know each other's status. And you have to realize senior citizens used condoms before there were birth control pills to prevent pregnancy. Now they can't get pregnant, so they don't really see a need to have a condom. But they don't understand that there are diseases out here now that weren't even around when they were younger. Anything they got then, syphilis or gonorrhea, penicillin cured it. They have diseases today penicillin is scared of. It doesn't work. And so they need to be educated more so than younger people, or as much as younger people, because of what they don't know. They assume their doctors are testing them when they draw blood, and they're not. They don't realize they have to ask to be tested for any sexually transmitted disease.
And we have to say this is very important because we're trying to push routine testing. We also want to educate our physicians and nurse practitioners and PAs. You asked the question, include that with the regular blood work. You know, I want to do an HIV test along with checking your blood for your diabetes, checking your cholesterol. But because we're seeing this among older adults, we want to make sure that we offer this to you and educating the senior to ask for it if that provider does not ask.
Yes. This show is being sponsored by Coiffure Exclusive Salon. We are a hair extension, hair replacement salon. If you're transitioning from relaxed to natural, please give us a call, 410-663-2643. Also, I wonder, before we run out of time, tomorrow is National HIV, AIDS, and Aging Awareness Day. Let's talk about that.
Yes. In 15 senior centers, we are offering HIV testing. Today, we're doing it at Forest Park from 11 to 1. And each day of the week is going to be a different senior center. If you have a question about it, call your senior center to find out if testing is being done and what time. But it's a span of 2 hours because of the National HIV Aging and Awareness Day. Baltimore is on the map for being able to do this for the second year. Know your status, get tested. At least get the information, and if you're not sexually active, you can help somebody else. You can help a neighbor, grandchild, your own children. Because there are seniors that are not sexually active, but there are seniors that are.
Yes. Are there any educational resources for seniors that's readily available?
Yes, there is a lot of the Baltimore City Health Department and the Maryland Health and Mental Health Administration has pamphlets on what people over 50 should know about HIV, what people of faith should know about HIV, and a lot of seniors are connected to a church, so those are good things.
And we have a wonderful support group, Older Women Embracing Life, for women over 50 affected or infected with HIV. We meet every first Wednesday, 240 North Franklintown Road. You're certainly welcome to come, and you can give me a call, Dorcas Baker, 443-287-4779 for further information.
Thank you so much.
Thank you
Anna
very
and
much.
Dorcas, for
Welcome.
coming in.
You're so welcome.
So
Church.
until next week, bye-bye.
Okay.
It's too short.
We're done.
All right. You want to say something to the camera before you leave?
Get tested, get tested, get tested.
Very good.
Yep.
Excellent job.
Yeah.
Okay.